Okay, so good morning, Charlie and Coral, and welcome to this interview. We are very happy to have this moment with both of you to talk about your evidence review, which is entitled Best Practice in Working with People with Mental Health Problems on Probation, which you authored. You already know me, but for the audience, I am Cristina Neves. I work in the Portuguese Probation and Prison Service. I currently work as head of the Community Sanctions and Measures Division. And I also have the honor of being the chair of the CEP expert group on probation and mental health, for which this research is, of course, of particular interest. I'm also going to make a brief presentation of both of you for our audience. I will start with Charlie Brooker. He's an honorary professor at Royal Holloway University in London. I must also say that Charlie has had a long collaboration with CEP, namely on the European Survey on Probation Staff Knowledge of and Attitudes to Mental Illness. I must say that this research is actually inspiring a lot of the work that we are doing at our expert group, since we will try to base on this knowledge to contribute with recommendations to address the gaps and the needs that were identified regarding staff training. So thank you for that. I'm also presenting Dr. Coral Sirdifield, who is a senior research associate at the University of Lincoln, where she leads research around understanding and addressing the health needs of people in the criminal justice system. So, of course, the work of both of you is very relevant for the work of the Confederation of European Probation, and as such, we are here today to address a few questions about your work. So I will start making the questions. So on your work, this evidence review, you argue that contact with the probation service can provide an opportunity to engage people with support who would otherwise not be able to access this support. From what you have discovered and know about the mental health services in Europe, do you think the mental health sector shares this view about the advantages of working in collaboration with the justice sector and in particular with probation services?
Well, I'm going to start by answering this question. I think I have to say that generally the answer to that question is no. I don't think they share the same aspiration in this regard. I mean, I think that obviously we know England more than any other country, and it's decidedly true in England that over the last 10 to 15 years, we've seen a marked decline in mental health services and their support to the criminal justice system. Oh, not just probation. Way back in 2010, there used to be an organisation run within the Department of Health, the central body for determining health policy in England on offender health. That disappeared. That no longer exists. Its purpose was to help reach a point where equivalence was reached with offenders, whether they're in the community or the prison, in relation to the healthcare being offered to the general population. And I think we can say categorically in England that's not the case. Doing the European survey for the Council of Europe, when we come to Europe, I know there are some countries where that's a better relationship. Your own, Cristina, Portugal, seems to have a better working alliance with local community mental health services than some countries. I think that the situation in Ireland is changing because they are integrating probation and mental health services through legislation in a way that hasn't happened before. I know that in Northern Ireland, who employ 18 clinical forensic psychologists within their probation service for a population of about 2 million, there is a much better relationship with mental health services. And that's because these clinical psychologists can advise probation staff about the direction in which they should be referring people. So I'll just leave my answer there for the moment. Coral might want to come in.
I think you've done a pretty thorough job there.
Yes, thank you so much. I think that we can say that this is more or less the situation in all countries in Europe, probably.
I think so, yeah.
Yeah. You also mentioned that people on probation have complex needs that services are not designed to cater for. I think we could add that some of the challenges that arise in working with this population arise because they are mandated clients. They have very low motivation for treatment and low motivation for change. Going back to the mental health sector, how prepared do you think that the mainstream services in mental health are to deal with these specificities of this population, and what should be done to better prepare them for that?
We've had several cases in England recently where there have been murders take place by people serving probation order. And in certainly one of those cases, at the inquest, ruling has found that mental health services were very unresponsive to the needs of the probation officer who was desperately trying to find the right sort of help. Someone who was using substances, had a personality disorder, and elements of a psychosis. Now, I think we have to acknowledge that the complexity of mental health presentations in probation and in prison are very different to the mainstream client that will be seen in mental health services routinely, from the general population. And I think this actually chimes with a later question in this interview, which will be to do with the etiology of mental health disorders. But we'll come to that. I think that we have siloed mental health services where you get the situation where someone with a drug or alcohol problem and a psychosis is referred to a mental health service who says, no, until that drug alcohol problem is sorted out, we're not treating this person. Then, if you're lucky, get a referral to an alcohol or drug service for the opposite. No, until that mental illness is out or treated, not treating drug. The siloing of services that way is very unhelpful.
Yeah, and all services can decline working with the client or the offender, but of course not the probation service. And so justice system ends up staying with this problem and not being able to solve it.
And it causes, we have to acknowledge this, for the probation staff involved, it involves an enormous amount of anxiety and distress. Coral and I gave a paper once about a prevalence, and a probation officer stood up in the audience talking about how she tried to get someone into an A&E department who was suicidal on a Friday night, of course, always a Friday night, and she was in tears as she told us. It had marked her, it had been traumatic, and she was still unable to move on from the horror of that night and that working with that person. We must never forget that, and I think one of the problems with mental health services, certainly in England, they become very unfriendly in a way. So if you don't turn up for your first appointment, you get another one. But if you don't turn up for the second appointment, that's it, you're out. We're not going to see you. We know the nature of probation clients. They're not particularly well organised often. They can be very chaotic. They're not going to make an appointment to a clinic that's 2.5 miles away with no money for the bus fare.
All those other barriers, isn't it, as well? It's not just money for the bus fare, it's how long does it actually take to get to the service? Is it a couple of buses away, in which case, if you're lucky enough to have a job, you're kind of coming out of work and spending half the day to get there, potentially, the same to go back. You might be encountering stigma when you get there because people know that you're on probation, or the service might be just provided online nowadays, in which case, if you don't have access to the digital technology and the ability to use it, you can't access the service.
We used to have in mental health services a form of treatment that was under the banner of assertive community. They were teams in mental health services based on an American model. They were wraparound. You had much smaller caseloads than your colleagues. You knew everybody. You had a relationship with everybody on your caseload. You knew where they'd be. If you wanted to meet them, you didn't have to give them you knew their lives so well. You know where their location would be. And couldn't run those services anymore. And I think it's the sort of model, ACT, wraparound of, in the States, it was case management, sometimes with budgets for probation, that clients on probation would benefit from.
Yeah, definitely. And it's good to have those models. At least we have that inspiration. We just need the will to go ahead and try them, or at least continue using them.
Absolutely.
Yeah. So now going to another question. You also mentioned on your work that the relationship between mental illness and offending is complex, and it's definitely true. A lot of evidence about it, a lot of debate. On this debate, would you see mental illness as a risk factor for offending, as a responsivity issue, or is even relevant to have this debate on your perspective?
So I think that relationship is really complex. And I remember when I was doing my PhD, this is something that I had kind of rattling around in my head quite a lot of the time, what actually is that relationship? And I read a really good book by a lady called Jill P., who's actually devoted an entire book to that topic. So I think that just says something in itself about how complicated a picture that is. And I went back to that book recently, and I just wanted to read a little quote from that, where she says at the beginning, analysing the links between mental disorder and crime must be one of the most daunting tasks confronting any scholar. So I think that kind of says it all in a way. In terms of the R&R model that you refer to, it kind of depends how we're defining mental disorder within that. Obviously, the literature around that would say if you're looking at kind of common mental illnesses like, say, depression, that's not being seen as a criminogenic risk, but it is something to consider in terms of responsivity, because it could affect, how we want to engage with a person, how they're going to engage with us, how they're going to respond to any sort of support that we may wish to refer somebody into. But if we're also including substance misuse, then that's a slightly different thing, because that would be a risk factor. And I know Charlie was talking earlier about etiology of mental illness, and he's always sort of my guide when it comes to mental illness. And I know he would say that often we need to look back to trauma in somebody's life, and that whilst not everybody who's experienced trauma will go on to develop a mental illness, there can be that kind of pathway through. And things like substance misuse can be a response to severe trauma. So we need to kind of consider that relationship in our practice, I think. And also, criminal justice, the system's not just about punishment, it's also about rehabilitation. So in that sense, I think we have a kind of, a moral duty to support people in terms of their mental health in the round, really. And that contact with criminal justice as perverse as it might seem in a way, does provide us with that opportunity, to have contact with people that are not necessarily going to access mainstream care for all the reasons that we've spoken about before. So it's that chance to engage with people, offer those brief interventions, if we're skilled to do that, and provide that link into care.
I think also, Carl's talking there about the likelihood of trauma in childhood, whatever nature that trauma was. And, there might be a temptation if an assessment covers that related to drug use, maybe subsequent development of a mental illness. But, you can't do is say childhood trauma, they need a service, refer them off and think the job is done, because these issues can be very complex and be very lengthy in terms of time. Not just a question of drugs. It's not just a question of a trauma service and shelving someone away. It is patient staff absolutely key still. Maintain a good working relationship and demonstrate some sort of caring through that. I know we have a probation service that's become about offender management than caring, and Rob Canton's really paper in the Probation Journal about that. But that doesn't stop the need for that kind of relationship, because there are many other needs, aren't there? There's accommodation, is that an issue? We know, for example, that people with accommodation needs are more likely to attempt suicide. And we have the highest statistics for suicide, more than even prisons, far more than the general population. And that's an important issue. Does this person present in terms of risk?
Yeah, and maybe that is an issue that is still underestimated, the suicide risk on probation. So it's also an area where we do need more investment in terms of not only research, but also working with professionals to be aware of that possibility. At least in Portugal, I can say that it's something that we don't even speak about.
Yeah, well, that's really interesting, because in the Council of Europe survey, only 4 out of 7 countries collect routine data suicide. So, in 43 countries, we've no idea how big a problem this is. In England, we do. And so you are able to trends and the impact of intervention policy level. But I think that suicide is a really key area, and we know more and more about those risk factors. And they're not always what you think.
Yeah. Yes, and also a lot of what your research has been bringing up is also that attention. So once again, very relevant for the work of everyone in the justice system.
If we ever get to a point where we have mental health training for probation,
oh yeah, we will.
then suicide needs to be a key component of that.
Definitely. Yeah, and maybe one of the priorities due to the lack of attention that it has been getting. Definitely.
I agree.
And going forward, and still keeping up with a little bit of the research and evidence in this area, studies about mental health of people on probation show that personality disorders are common. However, these are very difficult to treat, and at least in some countries, where I would include also Portugal, the mental health sector tends to not be keen on working with personality disorders especially if we are on the antisocial range of these disorders. And if there are no other symptoms, especially if there are not any psychotic symptoms. So, like I was saying before, these are some of the offenders that end up being returned. I use this expression, of course, with care, but return to the probation service without solution for treatment. How would you suggest that these cases should be dealt with?
Again, I have to reference England in this respect. I'm sorry, but we do have what we call an offender personality disorder pathway, with forensic psychologists working intensively with people who meet the service criteria. That's not just in probation, that's in prison as well. And there'll be follow-up as you come out of prison into the community-based part of that program. Unfortunately, there was a mission to evaluate the impact of that intervention, which reported during COVID, and sadly couldn't do anything that it wanted to do in the study. It'd be really nice to know the impact of that program is. In other countries, I have to say, from the sort of European survey perspective, this didn't come up as an item of good practice in any other country. So I can't really comment on other countries with personality disorder, but I suspect it's a really difficult area. And again, you know, it's something that should be a component part of the curriculum for mental health in probation.
Yes, thank you. And also thank you for sharing that example of England, because it's actually amazing that there is that service. And let's hope that we have the results soon, so that maybe other countries could be more motivated to try something like that, because it's a gap. It's a gap, I think, in many countries, and it's a part of the population with mental health problems that is left out of treatment, assessment to treat, access to treatment. Sorry.
This conversation is making me much more positive about England and probation and mental health than I ever was before.
But it's true. We need to compare with other systems and other realities, and I'm sure that England is quite ahead in a lot of aspects. And so I think you should be happy.
It's refreshing to hear.
It's refreshing for you, of course, and it's good. It's good for us that are in other countries to know that there are those experiences that we can be also inspired by.
I was going to say, I have a colleague who is working as a trainee forensic psychologist in such a service in London, and she's just finishing her PhD, interestingly, on risk factors associated with suicide, because that's another issue with personality disorder, and it was one of her risk factors found in her study. And that's to do, I think, with the impulsivity you sometimes find with personality disorder. Do you understand what I'm saying? You know, the urge to act suddenly and impulsively. And Favril, whose work is really interesting, has looked at suicide in prisons around the world, and also includes impulsiveness as a key feature of suicide in prison. So it's an important matter.
Yeah, and it makes sense that the association that is identified, it makes a lot of sense. I would now probably take the opportunity that we are already talking about training and the importance of the preparation of the professionals in probation to work with these problems. And I would go now to a question about it. So, of course, as you've been saying in this interview and also on your report, you say that one of the features of working well with people with mental health problems on probation involves proper training of probation staff. So probably summing up a little bit of what has been talked here, and also what you found on your research, and also from your experience, how should this training look like, the training for probation staff? Do you think there should be a European standard for training probation officers on this topic?
Well, I don't think we entirely know, do we? I think that's something that we need to do kind of more research into. We have in the past put together mental health awareness training for probation staff, which we piloted across one region of the UK through a sort of train the trainer model. And I would say that was fairly successful in terms of, we were able to capture improved knowledge at the end of that. But that was only a relatively small scale study, and we couldn't look at kind of how long any improvements lasted for within that study. And I think we'd potentially change some of that content now, because that was produced a while ago. And one thing that we've been talking about recently is the idea of having lived experience input into training. So that would be quite key. And that's a theme that came out from a piece of work that we were doing more recently, where we worked with a third sector organisation here called Revolving Doors, which has a group of people with lived experience of criminal justice. And they certainly felt that having that input into staff training would be potentially really valuable, and yeah, I can definitely see potential for that. In terms of the European question, my view would be kind of yes and no, because I think potentially it's good to have some kind of top level standards or areas that we feel are important, but it's also important that we recognize those kind of local differences and that we can take those into account too. So there could be kind of structural level stuff that we can do, which might apply across countries, but we do also need to think about that local context and how things can be kind of operationalized in different settings, to account for variations in population and the way that services are structured and so on, so that staff have that kind of local level knowledge of the needs of the people that they're working with, that's up to date, so they have kind of really good data. What do the needs of our population look like now? Because that changes over time, especially with things like substance misuse. That definitely, there are different trends in that, and that they also have that really in-depth knowledge of what the local provision available to them is, and how do we refer people into that provision. So yes and no in that sense.
I don't think you can even begin to start planning what a curriculum looks like. Having said what I've said already about them, but those are two key clinical issues. Until a service in a country articulates what the role of the probation officer is in relation to someone mentally ill, what are they supposed to do? Are they supposed to assess them and pass them on to a mental health service with a diagnosis? Are they supposed to? What are they supposed to do? I don't know. We had a training strategy again in England, which said that the role twofold, basically, whatever that means, to detect the mental illness and to refer on to the appropriate agency. But what knowledge and attitude and skills do you need for mental illness? We've written papers saying, well, one of the ways probation staff could do this is using short outcome measures, where screening tools are employed to say, yeah, this person's like to have personality, this person's like to be blah, blah, blah. This person's like to have a psychosis. There's been very little reaction to our papers about that kind of approach. But it does behove probation services to define what probation staff's role is.
Mm-hmm.
I mean, you're in charge of a probation service. You say the role was Do you articulate it in a policy statement?
Yeah, actually, we don't. I mean, I would say that it would be the same as with any other probationer, any other case. So we are lacking that specificity of what should we do when we are with people with mental health problem, because what we do is exactly the same that we do with any other case. So I would say from your answer that one, we probably would need some umbrella standards or principles that could be adjusted to the reality of each country, or even within a country to the reality of each service, geographical area. We should not forget to evaluate the outcome of these efforts when we do training or when we try programs to train staff. Let's see if it's working. Make sure that we clarify the role of the probation officer. And maybe I could add that it would also be important to work on training for the mental health sector about probation, right? So probably this has to be training not only for probation regarding mental health, but also for mental health regarding probation. Maybe it's the only way, at least in countries or in systems where communication is not so good, maybe it's the only way to make it work.
Yeah, that's a good point.
Yeah. So I think maybe this is a good point to finish our interview. I think we went through the main points. Would you like to add something, Charlie and Coral?
I'm very pleased, obviously, that having undertaken the European Survey of Knowledge and Attitudes, and we nearly had 600 patient staff reply. Some countries didn't reply at all, but others replied very heartedly. But to come out of all that and to have a score on a knowledge and attitudes med that tells you that probation staff's knowledge of and attitude to mental illness is no better than the general population is dire. That is dire when you're coming into contact with so many people, those problems. That's what I'd say.
Yeah, and hopefully the work of the CEP expert group can contribute a little bit to overcome that situation, or at least reflect on how each jurisdiction could work to overcome those limitations. So I would like to thank you a lot to Charlie and Coral for your precious inputs and your thoughts about this issue, which is a very, very complex issue. As I was saying, and as chair of the CEP expert group, I will make sure that your recommendations are taken into account in the work of CEP and what we can do at the European level with the connections we have with a lot of countries and a lot of realities. Let me also take this opportunity to announce that CEP is organizing a workshop on mental health in probation that is going to take place in Barcelona in 26 and 27 November, where surely we will have the opportunity to discuss some of the points that were mentioned here today, also other relevant topics such as resilience and probation, trauma, as was also mentioned here today, gender responsive approaches, and so on. And so you are very welcome to attend. I hope to see you all there. And this is the closing of our interview on behalf of CEP. Thank you so much, Charlie and Coral, for your time, and a lot of success for your research is what I personally wish for you, and also on behalf of everyone that works in the justice system. Thank you.
Thank you, Cristina.
Thank you.
Thank you.
Thanks.
Bye.